one of the most pressing needs in healthcare is just trained medical professionals and doctors.
I think we delivered every request they had.
Everything has had in mind patients that these future physicians are going to serve.
Welcome to the University of Missouri School of Medicine Patient-Centered Care Learning Center. I'm Weldon Webb, Associate Dean for Class Expansion. The whole thought of this started back in 2000, the fall of 2007.
It was a collaborative effort that included organizations and institutions that normally compete with one another coming together to make this happen. The two largest employers in our part of the state are CoxHealth and Mercy. They're competitors, but they jointly collaborated, worked together to make this happen. The University of Missouri and Missouri State University in Springfield collaborated to work together to advocate in the halls of the Capitol, to share services where that could be done.
The proposal was to increase enrollment by a third, or 32 students per class. In order to do that, you have to have the facilities here in Columbia for the first 2 years of medical school, and you need the clinical space, and that was in Springfield.
1, 2, 3, dig!
When we first started out in the planning of this whole building, we had two overriding goals. We wanted the building to be reflective of patient-centered care, because that's what we're all about. And the other thing, we wanted the building to be reflective of Missouri, its heritage, and its citizens.
And so how the building was envisioned in the first place, how it's been designed, all of the artwork, everything has had in mind patients that these future physicians are going to serve. From the beginning, our goal was to have people walk in and be reminded constantly as they work here, as they visit here, as they learn here, that this is about serving. And here are examples of some of the people that we're all preparing to serve.
I was on one of the committees that helped to design it and keep the theme of Missouri running through it, and so being able to walk through the halls and point out places that are close to my hometown, or see wood that I know was used in wagons that went through trails near my home, it's very meaningful. It makes you feel like you belong.
On one of the floors, they used a certain wood from the Springfield area. They have the river running down the side of the wood where I can locate around the area where I'm from.
I know this spot right here because I go fishing here when I go home. Getting to see something like this, especially for the new students who may not be from Missouri, it's a cool thing for them to see, and then people from there, it's pretty awesome to see as well. I don't know any medical schools in the country that probably have anything like this.
That stone that you're stepping on when you enter the building has a great story to tell. It was handled by the same contractor, Carthage Stoneworks, for the entire duration of the stone. It was quarried, originally installed, salvaged, and newly installed by the same company, and never left a radius of more than 150 miles from where it was originally quarried.
The building is a symbol of the patient-centeredness and all the other things, all the other great qualities that we are quite confident our graduates will have when they go out to serve the people of Missouri and beyond.
When you compare it to starting a new medical school, which will cost you anywhere from $500 million to $1 billion, it was a very cost-effective way to expand enrollment for the #1 medical school in the state of Missouri.
Having something grounded in Missouri will draw a lot of future students in from across the nation, just because the pride of graduating from here.
We think we're going to retain a lot of those professionals right in Springfield and throughout all of Missouri.
These walls have all of Missouri surrounding you, and they're here to support you, so stick with it. You can do it.